Perfect. All right. Hi, everyone. Thanks for joining today. So I am Lauren. I am the school epidemiologist. I work with those IDR reports. So I'm just going to give you kind of a step-by-step overview of it, how to fill it out exactly, and hopefully using the same kind of printout that you guys will use. So I have a Synergy printout example that we'll use to complete our IDR. All right, so we're going to talk about what it is, who all needs to complete it, Arizona State school immunization requirements, some FAQs that we get, the resources that we have available for this, and then we'll end with our walkthrough. Hopefully this won't take the whole hour, but I do want to save time so that we have time for Q&As at the end. So the IDR is the annual state level self-reported survey about our routine childhood immunizations. This opens early September and it is due by November 15th every year. So that is a hard deadline. So please make sure you are getting it in by November 15th. And it assesses immunization coverage and exemption data for childcare preschools, kindergarten, and sixth grade. So if you have, if you work at a school that does not have those grades, then you don't need to worry about the IDR. But if you do have those grades at your school, then you are going to need to complete it. And it's intended to be a representative sample of the immunization coverage here in Arizona. So if you look to the right, we kind of have those data points. You can, for the state level, you can kind of see where our state lies. This data is also submitted to the CDC, and they collect data for the entire country. And you can kind of see how Arizona then stacks up to other states. And that data is gathered by the IDR. So it's one of the main factors in determining state and local health department activities in regards to immunizations. It helps us identify pockets of under-vaccinated students and supports additional measures to assess community vulnerability. Parents and anyone in the public can look at each school's immunization rates, so especially when considering enrollment. And then this data is shared with the CDC, community stakeholders, and community members. So all licensed child care providers with children who are 18 months to 59 months of age, so 5 years old, is going to need to fill this out, and that includes child care centers, home-based providers, Head Start or early Head Start, preschools, and pre-Ks. And then also all schools with children who are either in kindergarten or sixth grade. And regardless of if the school is a public school, private school, or charter school, it needs to be filled out regardless. And schools with 10 or fewer kids in the grades need to acknowledge the IDR by registering and then just clicking the 10 or fewer question and submitting it. There won't be any data to fill out. I'll show you an example of that too later. All right. So then for our homeschool and distance learning programs, children who are homeschooled or students of distant learning programs like an online school, if they participate in any activities on a school campus, whether that be a sports activity after school, band, field trips, testing, if they come in for that, then they need to be submitting their immunization records to that school. And they should be included in that school's total counts for when they go through and fill out their IDR reports. And children who are entirely home-based and do not participate in activities on a school campus, If it's a fully online school, then you do not need to worry about submitting an IDR. So our Arizona state requirements, we have these available on our website, just quick little reminders. For the childcare, it's this column here that we are going to be concerned about. And then for kindergarten up, we're over here, the 5, 4, 3, 2, 1. Kind of an easy way to remember it. And then for our exemption forms, a current ADHS form needs to be used for all exemptions. You should not be accepting any other forms, even if it's from a doctor's office. These can be found on our website as well. I'll share where all our resources and stuff are later on. And reminders that the religious exemption form is only valid for childcare, preschool, and Head Start. And the personal belief exemption form is valid only for the kindergarten graders. The medical exemption form, though, that can be used for any age, any grade. So just a few quick questions I've been seeing. So the difference between fully immunized and in compliance. So fully immunized is the percent of children who have received the required dose for each vaccine, and they are up to date on those. So the target range for this is we want to see 95% and above, ideally. Compliance is the percentage of children who either have an immunization record or a valid exemption on file. So for this, we want 100%. We just want to know which ones or how many students are covered or exempt. And then we do give out certificates, typically around in the springtime, once I've kind of gone through the data. We give out certificates to schools who do meet these targets. So an example of this, so in a class of 100 students, there's 80 kids fully vaccinated for MMR, there's 10 exempt, and then there's 10 students who they're not exempt, but we also don't have up-to-date immunization records. So the coverage then would be 80% are fully immunized, and the compliance is that 90% of that grade is then compliant. So then the difference between conditional admission, catch-up, minimum interval, what all does that mean? So conditional admissions is if the student is in the process of completing the valid recommendation or the required recommendations, if there's that spacing that they have to wait for, but the parents are working on getting them caught up, then they would be considered conditional admission. So catch-up is those children who have had at least one dose, usually late, and they are utilizing the minimum interval period before they can receive the next dose. The IDR survey catch-up question does not include children who have had less than one dose of the vaccine, have no record of immunizations. They either have an exemption form on file or no exemption form on file. If someone's choosing not to vaccinate, then they're not in a catch-up scenario. And again, that minimum interval is the least amount of time between required doses to be considered valid. So like for MMR and varicella, there's that 28-day period. Some of them have 6 months. So we do have a flow chart thing that we've made too for each vaccine, and we broke it up by the childcare and the grade schoolers as well. So that should be helpful. And that's linked in the questions if you have questions about that as you're filling out the report. So then the hepatitis A reporting requirements. So all preschools and childcare facilities do need to fill this out. And Hep A is only required here in Maricopa County, but we do need this data for analysis and reporting purposes. So if you're outside outside of Maricopa County, then your responses to the HEP-A questions will not count against you or affect your ability for a certificate if you're trying to get that 95% coverage rate. And it's not necessary to add a comment in the comment section at the end of the survey, because we do take your location into account. So then some of the resources that we have available, your local county health department is going to be super helpful when filling out this IDR. So they can help with completing the IDR survey. If you have vaccine access and complex, vaccine issues, if you have foreign vaccine records that you need help translated, then you can contact your county and they are great. And they will help you with that. Some additional links and resources. We have, a handbook, our flow charts. We have little toolkits, the screening and referral form for you guys. We have tutorials. We have ACEs training slides if that's something that you're using to look up your immunization records as well. And then also the Granicus. Most of you probably heard about this webinar and the Granicus that we send out. It's kind of like a big listserv that we just email updates every now and then. So if you want to join that, if you did not receive information about the webinar this way, then you can also sign up on our website. So now moving into filling it out. Before we get started, just know, please save your work often. If you're logged out due to prolonged inactivity, power failure, anything like that, then you will lose any unsaved work. Saved work, though, can be revisited at any time upon logging back in. And the questions in the kindergarten and sixth grade surveys pertain to all children in the grade level, regardless of their chronological age. So keep that in mind for your 4-year-old kindergartners. They still need to have those required immunizations before starting school. Please make sure to answer each question as accurately as possible. And then you need to make sure that the numbers entered for each section equals your enrollment number. Your survey will give you an error and will not let you submit if those numbers don't match up. Surveys in progress will turn from gray to yellow. Submitted surveys will turn green. And then printable PDFs are available once you have submitted your survey. And the PDF is just for your records. We don't need it. And then modifications can be made to the survey even after submitting it up until November 15th. So all you have to do is just resubmit, and then it kind of just overrides your previous submissions. So then before you start, you're going to want to gather all of your student immunization records. The age is as of the date you are submitting your report. So keep this in mind. So you're 18 months through 59 months of age. You do not need to submit information for children younger than 18 months, even if they're 17 and a half months. You don't need to include them in the survey. And then also your kindergarten and sixth graders. Sixth grade, keep this in mind with those 12-year-olds for that Tdap and meningococcal, those sections. Those are age-based. And then you're going to submit the total counts rather than individual children's records. You're also going to add the total number of exemptions on file to it. And you're going to submit how many children have exemptions to every required vaccines. So that is what I have for you there. I'm going to get started with the demonstration now. So just real quick, this is where you can find our resources and signing up for our Granicus down here. This recording will also be posted on this site here. So if you need to go back at any time and review it. This is the list of all of our resources. Right. So now we are go to our site and say this is our first time using it. We need to register. We're going to go here. I've been playing around with this the last few days and it has been incredibly slow every time. So bear with me, please. But we are going to put our username. Our username is just going to be our email address that we want to use. Set up a password, our first name, our last name, our phone number, and then you're going to select your role. And then you're going to select the school that you're going to report for. So say we have a child care in Maricopa County. It's going to give us a list of all of them. Eventually. So if it's alphabetical, we're going to go through and select ours. And if you're having trouble finding yours, also look at it by the school districts. So Hamilton High, the Chandler Unified School District, because so many of the child care centers have similar names, you're selecting the correct one. But say yours isn't in here or yours is new, it's your first year open, then you need to click this link and you can add or request to add yours this way. So we'll fill this out. If you need to update a school, you can do so by clicking this, but right now we're going to add a school. We're going to fill out this information. Childcare is just childcare. Address. Right, and then submit, and you will receive a confirmation email once that update has been made in our system. So say you received your confirmation email. We'll find it. Here we are. And you'll add it. Make sure all of this information is correct. You can see there that it is now added to our account. And you'll click register. Now, if we wanted to just log back in, we can do that by going here. So you can see here that it is in our system when you log in. Yellow means it is started but not submitted. Now, say you have a grade school that you want to submit for, but it's not there. So then you would click the add and remove here. Scroll down, find our school. Make sure all of this information is correct. Again, if any of this needs to be changed or updated, then just click that link. It'll take you back to that survey, and then just click the updated instead of the add a school. But all of that looks good. It's now down here. So to toggle between these two, we just got to click which one we want. If you only have kindergarten, then sixth grade is still going to show up, or vice versa. But just only fill out the one that, or the grade that you need. Just if it's grayed out, just pretend it's not there, basically. So we are going to fill out a kindergarten report. Make sure that you are filling out for the correct grade, because if you submit it and then you realize, oh, actually I submitted my sixth grade numbers for kindergarten, it's pretty difficult to kind of swap those to the correct grades because there are a few different immunization questions asked. So just make sure that you are doing kindergarten or sixth grade. And I do have an example report. Let's see if I can split the screen. So this is from Synergy. I know there's also like Power School, Infinite Campus. So I thank you for the school nurse that sent me kind of an outline to go off of to make up some data. So this is our kindergarten class. And these are the individual students and their records for Tdap, polio, MMR, Hep B, and varicella, which does match up to these sections in here as well. So do we have 10 or fewer students? No, we have 47 students. So we're going to type in 47 here. Do we use a school information system? Yes, this one that printed out this report was Synergy. And yes, we're going to say our school is participating in the immunization education course for personal belief exemptions. So we're going to go through and we are going to look at this first column here for our DTAP. So how many have received are you guys not able to see the other one? That would be helpful. Would be good.
I can see your IDR screen, Lauren.
How about that?
Yes, now we can see both.
All right. So again, this is what Synergy printed out for me. We have 47 students here, and then each student's individual immunizations, and they do line up the immunizations up here. So for DTAP, how many students have received a total of 4 or more? So we're going to look at our list, and I kind of already marked up some to help me when I'm filling this out. I marked up my exemptions. So we have 41 students. And we do have some exemptions. However, for the sake of this demonstration, we're going to say that these are all personal belief exemptions. But those, I'm not sure how other school systems work, if they kind of separate them out. But if not, you will need to kind of gather those and see if you have any medical or personal beliefs. So we're going to say that all of these are our personal belief ones. So we have 6 of those. We don't have any students in a catch-up scenario. And we don't have any students unaccounted for. So we either have a record on file or an exemption on file for them. So polio now. And we want this column kind of go through. So how many students have had at least 3 to 4 doses? Now, if you look here, our kiddos, Joey and Matt, they have had they do have some polios. You know, he's got 3 and he's got 3. But if they were given, so if the last polio was given after 4 years of age, then you can count them as immune. But if these 3 doses were given before 4 years of age, then you're going to count them with the exemptions. So for the sake of this demonstration, we're going to say they got their childhood or their ones, you know, up until they were about 15 months, and then they haven't gotten their ones for kindergarten entry. So that's why they have those exemptions there. So we've got 41, 0 medical exemptions. Those 6 are personal belief exemptions. No one's on a catch-up scenario, and everyone is accounted for. Now,
Lauren,
yes.
sorry, real quick. A few people are asking which form or report that is in Synergy. Do you know?
I am not sure about that. I'm not familiar with the school systems.
Mackenzie, raise your hand. Mackenzie, do you know? Oh, Mackenzie cannot unmute. Oh, so Denise said it's the hit HLT 403 in Synergy. Okay, we got it. Thank you, Lauren.
So then for our polio, or no, for our MMR, I just finished our polio. So we're going to look through our MMR list real quick. And let's see, Mateo only has 1 MMR vaccine, but Synergy said yes. So again, for the sake of this demonstration, we are going to say that they are on a catch-up scenario, which means that they would have gotten this within the last few days. And you know that the parents are working on getting them caught up with that. And if you're not sure, again, what the catch-up scenarios and interval statuses are, you can just click here, and it will take you to our vaccine flow chart. So we want MMR. So student has 1 documentation. So again, no sooner than 4 weeks after that first dose. So for our MMR numbers, we have 40 who are received both doses. We don't have any medical exemptions. We have 6 personal belief exemptions for the MMR. And then, let's see, little Mateo is on a catch-up, so we're going to count him there. And then all students are accounted for, so that's 0. And again, each section here we want to make sure is adding up to that 47 enrollment total. Moving on down to Hep B. Looking at this column, we've got 42. No medical exemptions, 5 personal beliefs. Varicella. So Arizona only requires 1 for school entry, but the CDC recommends 2. And so for annual reporting purposes, we collect data on both. But for compliance and immunized, those numbers are based off of just that 1 dose. So we're going to, so I highlighted our students that have just 1 1 varicella vaccine. So that's 11 of them. And then we've got 31 that have received 2 or more doses. We have no medical exemptions. Personal belief exemptions for this are 5 of them. And everyone is up to date. So down here, this is where we're going to count up our individual immunization or exemption forms. So the total number of students with a personal belief exemption on file. So these kids all have 1 on file. So there's 6 kids in our class with a form on file. And then this question is asking how many are exempt from all vaccines. So Joey here, he has an exemption on file, but he is up to date for Hep B and varicella. So he's not going to be counted there. So we only have 5 students with an exemption form to all vaccines. We don't have any medical exemptions. If you have any comments, you can add them here. And then if you had help from your county health department, please add this here. But then we will just submit our report. And now it is green, so that's how we know that it is then successfully filled out. And if we wanted to go and print that copy, then we can do so by clicking here. And this is what the printout will look like. Again, this is just for your records. All right, now say we have like 9 students in our class, in our 6th grade class. We'll go here. And I just want to point out real quick, please pay attention for our Tdap and meningococcal. This is where it will ask those ages. So we kind of updated them this year. If you have previously filled it out, hopefully it is more clear about where these students will be counted, because again, each student only needs to be counted for once, because these sections need to add up to our total enrollment count. We don't want to be kind of double dipping and counting a kid in multiple brackets. So just pay attention to that. But do you have 10 or fewer students? Yeah, we only have 9. It's going to confirm that we only have that many. And so we're not going to have to fill out the rest of that. We just need to answer the enrollment count, and then we will submit that. And, that's completed because it is also green. Now, if you wanted to go back and change something, again, you just click in it, go and change whatever you need to change, and then you will resubmit, and that resubmission will override your previous submission. But that is it for filling out our IDR. Once you have done that, you are good to go. All done. Don't gotta worry about it for another year now. And then again, if you did reach those 95% coverage rates or 100% compliance, then in the springtime, we'll be reaching out to you to send you those certificates. But thank you everyone for your time today. Hopefully you feel a little bit more well prepared to fill out this report. So I can take any questions now.
Lauren,
Yes.
which vaccines are we not reporting on, like the Hib and the rotavirus? Are we still doing those? Or are we changing those this year?
So childcare has the most that you will report for. So that one you'll report for DTaP, polio, MMR, Hib, Hep A, Hep B, and varicella.
Okay, no rotavirus.
But again, like that Hib and Hep A, those are only reported for our childcare survey.
Thank you.
All right. I'm going to go through and kind of read some of these questions. So I see a question here clarifying that these questions pertain to the very first day of school. These questions pertain to the day as of you are submitting the report. So it's supposed to be kind of like a point in time viewpoint of the overall immunization records. So again, that's from September 3rd this year to November 15th. So if you want to fill it out next week, then these numbers that you're filling out are going to be as of October 20th or whatever day you select to fill it out. Will you have access to this afterwards to look back on? Yes, you can log back into your account and you will be able to go back and view these schools. But I do recommend, just printing a copy just for your records, just so you have that. Let's see, are the personal and religious exemption forms considered the same form? No, those are two separate forms. Again, religious is just childcare and personal belief is just grade school. And those can be found on our website. Let me pull that up. So here, this is where the parents will print off their religious belief form, and this is where parents will print off their personal belief form.
Lauren, I can ask the questions that were asked at the beginning, if that's okay.
Yes, please.
Okay, the first one I have is, how do we make the sixth graders get their immunizations at the age of 11 when the Tdap and meningococcal are not required until they are 12?
So they are required by their 12th birthday. So when you're doing this report, if you kind of see you have some 12 or 11-year-olds that they're going to be due soon, you can use this screening and referral form. And you can just send this home with the parents, just to kind of give them a heads up that, hey, this is going to be due soon for your kiddo.
All right, thank you. The next one is, how do I record children who have some immunizations but also have the exemption forms? Like if they have an exemption and the vaccine.
So for that, if say it's like multiple doses that they need and they kind of stopped halfway through, they did the first two and they don't want to get the rest of the series, then that's when they would need a exemption form. But if they got all caught up on all of their immunizations and then they want to, fill out their exemption form after that, You're still going to count them as immunized because, again, that exemption form doesn't take away their immunity. So if they're caught up on that one, say it's MMR, they're all caught up on, but they didn't get that last dose of the DTaP or something, then you'll just count them for the ones that they are caught up on, even if they have the exemption form.
Makes sense. Okay, and the next question is, if I work through 5, kindergarten through 5th grade, am I only doing IDR for kinder?
Yes.
Okay. Next one is, if I'm going to be doing multiple schools, is there steps I need to take?
No, so for that, you will just make sure that you are adding your schools all right here. So I'm just going to select a random school. That school's not going to work. But you'll just select your random school here, and it will be included in your list down here. So then when you go back to your home screen, you'll have multiple schools here, and you'll just make sure you're clicking the correct one to submit for.
All right, perfect. The next one is, I have preschoolers and some are 3, but Synergy is flagging them not compliant because they haven't had their 4-year-old shots. Are they non-compliant? If so, how do I document that?
If they're 3, then no, they don't need that shot until they start kindergarten. So
Okay.
you would just count them with the immunized, since they are for their age group caught up.
Okay, so disregard that flagging and Synergy.
Mm-hmm.
Okay. Next one is, if we were to do our IDR today and submit it, and then by 11:15 new student enrolls or immunization status changes, is our first submission enough to meet requirements?
Yes, because at the time that you submitted that report, that was reflective of the grade. So that you won't have to resubmit.
Okay, I think I did all the old ones. I see we have some new ones in the chat. Let's see. Okay, when reading the handbook, it appears that 6th graders have until their 13th birthday to be completely immunized. If they have their whole 12th year of age to get into compliance. Okay, I think you answered the question about their 12th birthday, but do you want to recap again?
Yeah, so Tdap and meningococcal, they can get anytime from 11 to 12. Again, like CDC recommendations and Arizona state requirements are a little different. We do need to go off of the Arizona state requirements, even if they do vary slightly. But yeah, they can get it starting at 11, and then by their 12th birthday, if they don't have that, that's when they would be considered non-compliant.
Okay, someone asked for school resources. I just put the link to where the school forms are.
Thank you.
But I think that's it. Does anyone have any questions that they want to ask verbally? You can raise your hands if you want to.
I have a question.
Yes.
We have providers. I'm located up in Yavapai County, and I'm at a middle school. We have local area providers that are not immunizing until they are 12. And the parents come back and say, I will take care of that with our provider, that they've gone for an 11-year-old checkup or a 10-year-old checkup, asked for school required vaccines, and the provider says, we will do them when you're 12.
So in that instance, so if the student has had, if they're like on a catch-up schedule with that DTaP, then they do have 5 years. So if they were kind of behind and they didn't get fully caught up till they were like 8 years old, then it's 5 years from that last tetanus-containing vaccine. So that would be 13. Otherwise, you could just do an exemption for that, just to make sure that everyone is still compliant.
Thank you.
Lauren,
Yes.
just a quick question. So in Synergy, those are the only 2 grades that I have to literally input all the immunizations. It's just my kindergarten and 6th graders.
Those are the only ones that we will receive data about.
Okay.
I'm not sure how Synergy really works. I'm not too familiar with all of those.
Okay.
But you should be keeping records of all of the students.
Yeah.
When they're enrolled, you should be collecting their immunizations.
I'm new to this school year and they've never done it in the school prior. So there's like nothing in Synergy. So I literally have to input everything for all these new kindergartens and our current 6th graders. But-
Yeah, so those kindergarten and 6th graders would definitely, I would say, prioritize those.
Okay.
But the other ones, you should be keeping records for all of those students. Because the 5th graders, you know, when they're moving on up to 6th grade, kind of at the end of 5th grade, you could kind of send home reminders like, hey, over summer,
Okay.
we're getting these ones.
Okay. Because I was like, oh my God, do I got to do every single student or just focus on kinder and 6 right now? Huh?
Yeah.
Okay. Thank you.
Well, if we don't have any other questions, then I am going to end the recording. Thank you all for your time, and I know this fell on fall break for a lot of schools. So again, this recording will be available on our website. And if, as you're completing your report, if you kind of want to follow along with this, then you can go ahead and do that. But thank you again. Hopefully this was helpful.
Yes. Thank you.
Kendra?
All right.
Kendra, I see you have your hand raised.
She also posted in chat if you want to look at that.
Yeah, my report's showing up with drawn students. Do I count them or
It's showing up with what?
withdrawn students?
No, don't include them.
In Synergy, you can, are you using Synergy?
Yes.
Yeah, on the top right corner where you have your school name, if you click that, you
Oh, no.
should be able to choose active or
Active.
inactive.
Okay.
So you want active only, and that should get rid of those students for you.
Perfect. And then does anyone know how my report's not showing exempt? The E? It's just showing a Y and an N.
Same, there's within Synergy, when you're pulling that report, there's a spot where you can click. Usually you have to kind of scroll down on that first page, and there's a spot where you can click show exemptions. You can
It shows
it's like a lot of
show
different.
only students with exemptions.
There should be a way to, sorry, let me see if I can get into it. 403. Yeah, so if you scroll down, show only. So it should show yours then if you're not clicking that.
Okay, I'll play around with it. Thank you.
Yeah, sorry. I'll stop the recording now. Thank you, Lauren.